Back pain is one of the most common health complaints worldwide. According to the World Health Organization, about 80% of people will experience it at some point in their lives. But here's the good news. In many cases, you can relieve and even prevent back pain naturally without relying on medications. In this video, we're going to explore the most common causes of back pain, simple exercises you can do at home, and effective natural techniques that can bring you much-needed relief. So stay tuned until the end, because these tips might just change your life. Let's begin by understanding the most common causes of back pain. Knowing what triggers your discomfort is essential to addressing it effectively. One of the leading causes is poor posture. Spending hours sitting incorrectly, slouching while walking, or constantly bending your neck to look at your phone puts undue stress on your spine and muscles. Another significant factor is a sedentary lifestyle. Lack of physical activity weakens the core and stabilizing muscles, making your back more vulnerable to strain and injury. Stress and muscle tension also play a crucial role. Emotional stress often manifests physically, especially in the lower back and neck areas. When we're stressed, we tend to tighten our muscles unconsciously, leading to chronic discomfort. Furthermore, sudden or repetitive movements can also lead to injury, whether it's lifting something heavy incorrectly or performing the same movement over and over. Improper body mechanics can easily cause strain. Lastly, structural issues like herniated discs, scoliosis, or degenerative diseases may be responsible, and these conditions typically require medical evaluation and treatment. Now that we understand the causes, let's move on to the solutions, starting with stretching exercises that can help relieve muscle tension and increase flexibility. Stretching is a fantastic way to ease back pain naturally, and you don't need any fancy equipment to get started. The first stretch I recommend is the cat-cow stretch, also known as Marjaryasana Vithalasana in yoga. Get down on all fours with your wrists under your shoulders and knees under your hips. As you inhale, arch your back, lifting your head and tailbone towards the ceiling, creating a cow posture. As you exhale, round your spine upwards, tucking your chin to your chest in a cat posture. Repeat this movement slowly about 10 times. This dynamic stretch gently mobilizes the spine and warms up the muscles. Another excellent stretch is for the piriformis muscle, which can often cause lower back pain when tight. Lie on your back, cross one leg over the other, and gently pull the uncrossed leg towards your chest until you feel a stretch in your glutes and lower back. Hold this position for about 20 to 30 seconds before switching sides. You can also perform a basic hamstring stretch to target the posterior chain, which includes your lower back. While standing or sitting, slowly reach towards your toes, keeping your knees slightly bent if necessary. The goal is to feel a gentle stretch down the back of your legs and into your lower back, but never force the movement. Lastly, try the child's pose or sit back on your heels, extend your arms forward on the floor, and rest your forehead down. This stretch gently lengthens the spine and relaxes the back muscles, providing immediate relief from tension. Hold for at least 30 seconds, breathing deeply to enhance relaxation. Stretching is great for immediate relief, but to prevent back pain in the long term, it's essential to strengthen the muscles that support your spine. Strong core muscles reduce the risk of injury and improve posture. Let's start with the plank. Lie face down, then lift your body off the floor, supporting yourself on your forearms and toes. Keep your body in a straight line from head to heels, engaging your core. If you're new to this exercise, start with 15-second holds and gradually work your way up as you gain strength. Another effective exercise is the glute bridge, also known as the pelvic lift. Lie on your back with your knees bent and feet flat on the floor. Slowly lift your hips towards the ceiling, squeezing your glutes at the top, then lower back down. Aim for 3 sets of 10 repetitions. This movement strengthens the glutes and lower back, providing more stability to your spine. The Superman exercise is also fantastic for strengthening the lower back. Lie face down with your arms extended in front of you. Simultaneously lift your arms, chest, and legs off the ground, holding for about 5 seconds before lowering. Perform this movement 10 times, focusing on engaging your back muscles. Lastly, incorporate squats into your routine. Stand with your feet shoulder-width apart, keep your chest up, and slowly lower yourself as if sitting in a chair. Make sure your knees don't go past your toes. Squats are excellent for building strength in the lower body and improving functional movement, which in turn reduces strain on the lower back. In addition to stretching and strengthening, there are several natural techniques that can complement your routine and provide further relief from back pain. One of the simplest methods is applying hot or cold compresses. Cold packs are ideal for acute pain or inflammation, helping to reduce swelling. Apply a cold pack wrapped in a cloth to the affected area for up to 20 minutes. On the other hand, heat therapy is beneficial for relaxing tight muscles and increasing blood flow. A warm compressed or heating pad applied for 15 to 20 minutes can significantly ease chronic pain and stiffness. Self-massage is another excellent technique. You can use your hands or a tennis ball for this. Place the ball between your back and a wall, then slowly move your body to apply pressure to tense areas. Use circular or back and forth motions to release muscle knots and improve circulation. Deep breathing, specifically diaphragmatic breathing, is also extremely helpful. Sit or lie comfortably. Inhale slowly through your nose, filling your abdomen, then exhale fully through your mouth. Practicing this for 5 minutes a day can reduce stress levels and subsequently lower muscle tension that contributes to back pain. Mindfulness and meditation practices are also highly recommended. By focusing your attention on the present moment and letting go of stress, you can mitigate one of the key contributors to chronic back pain. Emotional tension. Start with simple mindfulness sessions of 5 minutes, focusing solely on your breath, and gradually extend as you become more comfortable with the practice. Lastly, a warm bath can do wonders for your back. Immersing yourself in warm water relaxes the muscles, improves blood flow, and promotes a sense of well-being. Adding Epsom salts may further reduce muscle soreness due to their magnesium content. Now that we've covered exercises and techniques for relieving back pain, it's essential to discuss prevention. After all, preventing pain is always better than treating it after it occurs. The first step is maintaining proper posture. When sitting, keep your feet flat on the floor, your back straight, and your shoulders relaxed. Avoid slouching or leaning forward excessively, especially when using a computer or a phone. Consider adjusting your workstation to support good ergonomics. Another crucial tip is to change your position frequently. Sitting or standing in the same posture for extended periods puts strain on your muscles and joints. Make it a habit to get up, stretch, and walk around every 30 minutes to keep your body moving and prevent stiffness. Engaging in regular physical activity is one of the best ways to keep your back healthy. Activities like walking, swimming, yoga, or Pilates not only strengthen your muscles, but also improve your flexibility and balance, reducing the risk of injuries. Quality sleep also plays a vital role. Sleeping on a supportive mattress and maintaining a proper sleeping posture can prevent unnecessary strain on your back. Ideally, sleep on your side with a pillow between your knees to keep your spine aligned. Lastly, maintaining a healthy weight is critical. Excess weight, especially around the abdomen, can pull your pelvis forward and strain your lower back. A balanced diet and regular exercise help manage weight and support overall spinal health. To wrap up, I hope these exercises, techniques, and preventive tips help you manage and alleviate your back pain naturally and safely. Always remember to listen to your body and avoid pushing through severe pain. If your discomfort persists or worsens, it's essential to seek advice from a healthcare professional. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and turn on notifications so you don't miss out on more health and wellness tips. Also, share this video with friends or family members who might benefit from these techniques. Let me know in the comments below, which of these methods are you planning to try first? Thank you for watching. Take care of your back, and I'll see you in the next video. Would you like me to also create a catchy video title, description, and keyword tags optimized for YouTube?